Pediatrician's office is inundated with sick kids battling flu, croup, RSV, and COVID. In today's Pointers from a Pediatrician segment, Dr. Carrie Vijay Singha, the medical director and founder of Sienna Pediatrics in Henderson, spells out the impact this most recent variant of COVID is having on kids she's treating.
This wave of Omicron, we're definitely seeing more children being affected. This is actually like a flu season for pediatricians now. We're seeing a range of symptoms. The biggest change was croup. You know, we normally would talk about croup, which is a viral infection, infects the throat, and you can have a seal or basically a dog bark noise. And Omicron was added to the list of viruses, or variants to COVID coming in to give children croup. This is actually one of the ones why you want to bring your children to the office. We can do something, especially below 2 years of age, to give either prescribed oral steroids, or even maybe do an injection of steroids too. So that's number one we're seeing even in the last week or two. The other thing is children are having fever. They're having cough, runny nose. It can be a cold. It can appear like a flu-like illness too. That is a little different than what we saw before. We saw a lot of the dry coughs. We saw loss of taste and smell. But this one's kind of a hardier variant with children. I will tell you, fortunately, we have not had to have any children hospitalized in the last couple of weeks. There are reports out there where we're having children in the U.S. being hospitalized.
As a parent, you're at home, say your kids come down with certain circumstances. At what point do you want to see kids in your office? I bet you're inundated with everything. And how do you prioritize? What message you want to get out there to parents?
So basically, that's a great way, prioritizing children with symptoms. So just like the ones I just mentioned, those should have the children in the office to get seen. And the other thing is also remember there are other things. Flu is starting to increase. And so a lot of pediatricians are going to test for the flu and they're going to test for COVID. We saw a very large number of RSV children in the last 6 months, so we're still seeing some as well. There is just the common colds, of course, but we're seeing a lot of bacterial infections from the initial viral infections like ear infections, even some pneumonias. So those are the children with those symptoms we want to see. If you have a family member that tests positive, it is highly transmissible, like we are being told and we're seeing, but you may not have symptoms yet. It is better for you not to bring your child into the pediatrician's office at that point. Wait and see if there is actually symptoms too. We are also, as we're all fully aware, we're having healthcare workers get this despite our proper attire. And so we're trying to minimize the risk to our healthcare workers too, as much as possible. So please come into your pediatrician's office if you have symptoms. Also, bear with us. We are dealing with a shortage of rapid tests. My office is getting a bunch later today or tomorrow, but we were down a day and we are able to do PCRs, but that takes a couple days.
Dr. Vijay Singha adds that medical professionals are also seeing higher cases of COVID in the very young age range because no vaccine has been approved yet for the 2 to 5-year-olds. She says during vaccine trials, that age range didn't create antibodies as high as expected and more research is needed.